Hi, I am Ali Nisus, registered nurse and managing director of Nice Us Geriatric Home Care Training and Agency Limited, and this is Return the Favor, a web series giving you tips on how to properly care for your elderly parents. They took good care of you as a child, so now it's time to return the favor. Hi, and welcome back. Today's episode is titled Behavioral Conditions of Alzheimer's. So, last episode we looked at the Alzheimer's disease. We took a quick history of how it was discovered, a basic review of the disease process, and most importantly, the signs one may show that may indicate that they do have Alzheimer's. I will put the link here for that episode so you can look at it because it will help you understand what we're speaking about in this episode, right? So, as I said before, and I will say again, do not try to diagnose or to predict whether your elderly relative or loved one has Alzheimer's. Please get a medical review by a medical professional, most importantly a neurologist, maybe a medical doctor, to really determine whether your patient has Alzheimer's or not. This is very important because you want them to get the proper treatment in which they could handle this condition. All right? So today, we are going to look at behavioral conditions that may occur in someone with Alzheimer's. Why? Because when you know what you're looking for, you know how to mitigate the risk of what may happen when they express these behaviors, right? It is not intentional. They are not miserable. It is things that are happening because of a disease. And in order to, really help your relative, you need to be more empathetic, you need to understand, and you need to be patient with them in order for them to get the right treatment and the right support that they need, all right? So with these behavioral conditions, they may not experience all, but you can look out for them. And there are some that may happen in the earlier stage as opposed to in the later stages of Alzheimer's. All right, so let's get into it. The first one I want to talk about is falls. Now you may think, I fall all the time. Does that mean I have Alzheimer's? No. It's just that with someone who has cognitive impairment and they have spatial judgment issues, so they can't determine whether the space in front of them is wide enough or too narrow, right? They may make a judgment in walking and fall, all right? So they are more susceptible to falling when they have Alzheimer's. So what to do? You look at the flooring type. You don't want carpets that are shaggy. You want to make sure that the flooring itself will not cause them to fall. Walking aids, they may need a walker or a Zimmer frame, something to assist. Or while they are walking, you can help, you can chaperone them, right? Training in fall prevention. So there are certain things you may not think about. Maybe you need training from a professional to know exactly how to safeguard your relative from falling. You can consider getting one of those. Strengthening exercises. Now this one you will definitely need to consult with your doctor if you can engage in certain exercises with your elderly loved one. But the stronger their muscles are, the less likely they are to fall. Make sure there's a clear pathway, especially for frequently traversed paths. So you know that your relative usually goes to the washroom. Make sure that that path to the washroom is clear. Strategically placed handlebars. So you know that they would be getting up from the bed and it's a bit difficult for them, or maybe getting up off a chair maybe going to the washroom, the toilet is a bit on the lower side. You want to have handlebars where they can hold for support if necessary. And if they're in bed, make sure the bed rails are up. All right. So what's the next behavioral condition we want to look at? Wandering. So what is wandering? Wandering is when someone paces or they may walk off aimlessly. This may be due to overstimulation. So there's something in their environment that they don't like. Maybe they're feeling anxious. Maybe they're feeling uncomfortable. Maybe something is making them feel, as if they're not supposed to be there. So what to do? First off, reassure them. Make sure that they understand that you're there to assist, right? You look for clues. So they may start to walk off, they may get up for no reason, So look for clues on them wandering, right? If they have just started to walk, maybe you can join them and distract them. So you all are walking and talking, and then you kind of turn them the next way, right? So they wouldn't wander off out in the road and off somewhere. You can offer them toilet amenities. Sometimes they just want to use the toilet and they didn't even realize. And they got up and they started to walk and they're like, what am I walking for? Right? So maybe you can say, hey, let's go, come and use the washroom. Right? Remove their shoes. If you say, come on, sit down, let me take off your shoe. They're thinking, well, I went where I was supposed to go and now I'm taking off my shoes, right? So that is one way to deter them from wandering off. And then you may give them a distraction. They want to walk, carry them to do something, fold some towels or put away the plates, wash the wares, some kind of distraction, right? Now, if you are not around at the time that they are wandering, what you can do to mitigate the actual wandering itself, for their room, you can put a dark cloth or curtain or a mirror over their door. So when they go to the door, they see a mirror, they're not thinking that's a door, right? So that may stop them from wandering off. You can put on an ID bracelet. So in the event that unfortunately they do wander off and you can't find them, somebody could identify who they are and send them back home or send them to the police and they can call you and let you know of your relative status, right? Also, you can put a dark mat in front of the door. They may watch young and think it is a hole, so they wouldn't go through the door. All right, so the next behavior we're looking at is rummaging and hoarding. And this is where persons dig up little drawers or, little baskets, and they take the items that are in the vessel and hide it and put it in weird spaces, right? Now, and most importantly, do not scold them. These are things that they're doing. It's not like if they're doing it for spite. No, they're not miserable. They're just doing it because of the disease process, all right? Reorient them to the location of their items. So let them know, Granny, this is where you just keep so on and so on, and it's not over here, right? There. So you remember it's short-term memory loss, so keep on reorienting them to where their belongings are. When they are doing that activity, picking up stuff, you kind of distract them with something else. Distraction really helps. Again, offer toilet amenities. They may want to use the washroom and it's confused with the feeling that they're getting, so they start to dig, all right? You can also secure all valuables. Make sure you have any chemicals locked up, your keys high up, put it in a safe space. Learn their hiding places as well. So they may become a bit habitual with their hiding places, learn it. And last but not least, provide a rummaging drawer. So you have different stuff in the drawer and they could dig up and hide as much as they want if you realize that they're not cutting out the habit. All right? The next behavior is catastrophic reaction. So this is when persons become verbally and physically abusive. And this is a very telltale sign of Alzheimer's. So most importantly, you need to stay calm. Anxiety and fear is contagious. So you want to stay calm and make sure that they are comfortable, right? You need to identify yourself. In the heat of this frustration and the way they're feeling, they are going to forget. So identify who you are. Look for nonverbal cues before so you can anticipate. So maybe a grinding of the teeth and a ponging their hands or fists, look for that. Acknowledge the anger. Say, I know you are upset. I know you are. And look at your tone of voice and be careful of your tone of voice, right? Cause a distraction, a very subtle distraction. You don't want to get too flagrant with this distraction. Maybe an activity that they like, maybe some food or something like that. But restraints should be the last resort. And don't ever take the attack personally, please. It's because of the disease process. The final behavior we're going to look at is sundowning. So sundowning is a phenomenon that happens when persons who are suffering from Alzheimer's, they get a little more restless and confused at sunset. And this could be caused by a fear of the dark, right? This could be caused by not liking the surroundings. The place is too bright, the place is too dark, right? And the signs you can look out for is restlessness, anxiety, a worried expression on their face, reluctance to take off their clothes, reluctance to enter their room. They may take off their clothes, gritting of teeth. These are the kind of signs you will see. So what to do? The underlying cause may be pain, it may be hunger, it may be that they want to use the washroom. So ask them, are you in pain? Do you feel hungry, right? So it may be that. Make sure there's a night light in their room, especially just before sunset. You can put it on one time. Again, you can cause a distraction to see if it will help with the situation. Always use comforting words, right? And don't argue with them, please. Don't. And what you can do as well is develop a bedtime routine. Observe when these signs are coming on, and then you develop the routine just before they come on, right? It could be that you do an activity together or something. You will know your patient better than I, right? But these are the behaviors you can look out for, and those were the ways in which to mitigate the risk to your loved one. Don't forget to subscribe to get more content like this. And if you want more details on the topic for today, check out the blog on our website. Link in the description. Until next time.